Hello, my name's Sean. Today is June 15th, 2025. It's a Sunday, and tomorrow morning I will be going in for a two-level artificial disc replacement in my cervical spine, specifically at C5 and 6, and then also at C6 and 7. I wanted to kind of cover this. I didn't find a ton of information on this procedure that was documented or out for consumption on the internet. So I wanted to document this and let you know what I've been going through and what the recommendation was and what the outcome is going to be. So, like I said, today is the 15th of June, 2025, and tomorrow morning is the actual procedure at 10 a.m. Mountain. And this beginning section here, I just wanted to cover my experience and what led up to this. Um, I, w- I want to start by saying that there was no specific injury or no specific event that led up to whatever happened with my C5 and 6 and also C6 and 7 spot in my cervical spine. So I don't actually know the root cause as to why it is or why it has become the way that it is. Um, it really became pronounced when everyone was sent home for COVID. I work in technology, and at the time, I was working for a company that was largely digital. So most of their staff was sent home for the COVID pandemic, and when I was sent home, I wasn't working on site anymore. And one of the things that happened was I didn't have a real desk at home. I had just moved into a new place, and I started to notice a lot of tingling and loss of sensation in my left arm. On the video here, it's right, but this is my left here, and so when that started, I didn't really know what was going on. I knew it was probably something related to my neck or nerve related, but I didn't actually follow up on it until much later. I kind of went through a period of like both pain and loss of sensation in my left arm for quite a while before I actually decided to take action on it. So as you can see, it's 2025, and tomorrow morning is finally the procedure. Um, up to this point, I've kind of gone through mild like chiropractic care, which was a little bit helpful. I was trying to be a lot more diligent about my lifestyle and the things that I was doing rather than sitting at a desk all day and things like that. So that actually helped quite a bit, stretching and exercise and getting out and all that sort of stuff. So that did help quite a bit, but ultimately the degradation or degeneration on those two spine or those two discs has reached a point where it needs to have them replaced. And to be clear, this recommendation was made to me by a specialist here in the Denver metro area. His name's Dr. Eddie Zvanken. I think that's how it's pronounced. Not 100% sure, but it's the Colorado Brain and Spine Institute in Englewood. And I it I definitely trust the recommendation. Tomorrow morning's procedure, like I said, but in 2024, I had gone to my primary care provider for a standard checkup sort of thing, annual thing, and I had let them know what was going on, and so I was referred to Colorado Brain and Spine Institute, and I went and got a preemptive MRI of the cervical spine, and nothing has changed. I had another one done this year. Nothing has changed really dramatically, and I'll read that stuff here in a second. But um, basically, the findings were the same in both years. I had one in April of this year, and I had one in April of last year. The difference being April of last year, I didn't actually take action on it. So I had the scan done, and I didn't actually follow up on it with Colorado Brain and Spine. So that being said, this year I really wanted to actually do something about it. It's gotten to a point where it is kind of a quality of life issue. So let's kind of talk about what is actually happening. So on the left arm, basically, so there's a couple of different things that happen. So if I go back with my neck, I start to feel a pinching or pain sensation down the back of my left arm, and if I go to the left, if I tilt my head to the left, I get the same sensation. And if I combine those two things, back and to the left, it becomes fairly extreme. And then I start to lose sensation down the back of my arm on the left arm. And it was worse back in 2020. At some point, it was pretty extreme. I would start to lose feeling in fingers and things like that. But it's more mild now. It is more of a quality of life issue, like I was saying. I just really want this taken care of, and I want to get past it. A little bit of history as far as my family is concerned, most of the men on my dad's side of the family have had some sort of cervical spine issue. I'm not terribly surprised that this is happening to me. I am surprised that it happened to me at 35 years old, or even earlier than that, because it's been going on for a while. But I am surprised that it happened to me at 35 years old. Um, that being said, it's pretty similar to what they've experienced, my dad and his brothers. So I'm not taken off guard by that. Um, but basically, this year, my primary care provider, I went in for my annual checkup once again this year, and we got the referral again for Colorado Brain and Spine Institute. And they asked me to do a second image. And so I went in and had that taken care of in April. They reviewed it and made a recommendation for a 2 disc cervical spine disc replacement with artificial disc replacement. And I don't know a ton about this process, and I also don't know who the manufacturer is going to be for the artificial discs yet. I probably should have thought about that ahead of time, but I didn't. Um, but basically, here's I'll read it off to you from the findings on the imaging. Um, there are 3 notable things, which I've known already, but I just want to document this for the sake of letting others know what my experience is with this. So the first thing is, it says multi-level cervical spondylosis, including edematous degenerative endplate changes at C6 to C7 and reactive marrow edema within the left C7 inferior facet. This may contribute to localized neck pain. The second item here, moderate spinal canal stenosis at C6 to C7, no cord compression or myelopathic signal change. And then the third item is multi-level foraminal stenosis, including potential impingement on the left C4, left C6, and left C7 nerves. This may contribute to radiculopathy. And from what I understand, radiculopathy is the tingling or the loss of sensation in, arm, hands, fingers, that sort of thing. So those are the 3 major findings from the scan. The recommendation that came out of this was artificial disc replacement for C5 to C6 and then C6 to C7. I'm going to bring up what I've come to learn about this process. So I'm going to switch screens here. Let's bring this up. We'll do the screen share. And this is not the manufacturer. To be clear, I don't know if this is going to be the manufacturer, but there are some things here that I kind of want to cover just so folks are a little bit more familiar with it. So one of the things that I've noticed here is that this went into clinical usage in 1990, which is, good Lord, a long time ago now. And then this is basically the design. There are actually several different products that they provide. So they've got cervical spine, and then I think they've got so lumbar spine here. It's on the screen. Cervical and lumbar spine. And there's a little video here that goes through the procedure as to how it happens. And then there's a multi-step process, which I'll scroll down here. So here we go. So basically, it looks like there's a channel or a canal that's taken out on the top and bottom of whatever cervical spine, vertebrae that's there. And then there's an insert that takes place, and that's where we go back up here a little bit. This is what it would look like on the left-hand side here, at least from what I understand. And this is, my basically small or limited knowledge on how this whole thing works. I'll know more tomorrow, of course, but basically a simulation of what would normally be a functional, healthy cervical spine disc. And this is how this is going to happen for me. So I'm getting the 2 replaced right next to each other. Now, in some cases, there's a fusion that takes place. So cervical spine fusion seems to be pretty common. And so, for example, my dad and one of his brothers have both had cervical spine fusion surgeries. And it looks like the drawback to that could potentially be more rapid degeneration of the disc above and below where the fusion takes place, whereas this maintains mobility rather than essentially locking the 2 together. So there's that pivot point. So it maintains mobility in between the vertebrae and simulates what would be otherwise a normal cervical spine disc. So recommended, from what I've gathered, I don't know this to be factually true, but recommended for younger folks, and folks that are, you know, candidates for something like this, as opposed to, I guess, either damage from like an accident or something, or what would otherwise qualify for a fusion surgery to bond two of them together. Um, Advantages seems to include mobility, so maintaining the original or close to the original mobility in your cervical spine. So left, right, back, forward, all that sort of stuff. And it seems like there's less severe, like less trauma to the spine, rather than anchoring it, with screws and plates. It's an insert into what's already existing. And then, from what I understand, this material here that's on the top and bottom plate, which would be here, that promotes bone growth or promotes bone healing back to that particular surface area, which should make things bond permanently, at least with those two plates, and basically maintain the original mobility, or close to what was the original mobility in the cervical spine. Now, like I said, I don't know which manufacturer. I don't know if it's going to be this one here, the Pro Disc. I don't know if it's going to be something different. But it seems like this is a fairly new thing. When I mentioned that this was clinical usage in 1990 here, that does seem like a long time ago, but this particular process seems to be new for the last maybe 10 to 15 years. So I'm excited for for a couple things. One, I don't have to go through a fusion process and get at least a little bit limited mobility in my cervical spine. And then the second thing that I'm excited for is obviously resolving the issue. There seems to be pretty high confidence in the issue being resolved. Um, I'm quite tired of having issues with my left arm, so I'm really looking forward to this. I'm gonna have a lot more follow up after the procedure, of course. So what I'm gonna cover after, go back to this. So what I'm gonna cover after I get the procedure done, I'll wait, a week or two, maybe a few days, depending on how the pain is and how the mobility is. I'll do a follow up video based on my experience with, the incision, the process, pain management, all that sort of stuff. The results, of course, the results. That's really, really important to share with you guys. So this is just my effort in trying to share my experience with you, and see how it goes for me and whether or not I would recommend it based on my experience. Now, of course, I read the findings from the scan tonight, and everybody's going to be different. My results are not going to be your results. The other thing that I was going to share here too is what it actually looks like on the scan. So let me pull that up real quick here. I've got a couple of these. So I'll go back to sharing the screen here. Let's do this. So I don't I don't know a lot about imaging. I don't do a lot with imaging like this, but it's pretty obvious that 5 and 6 are impacted here. I've got that highlighted in red. And then on the other one, it's the same exact location, but you can see where the cord, there's a little bit of, it looks like intrusion on the cord, but the report from the MRI didn't reference that, like no impingement or no intrusion on the cord. So I don't know that that's true. And I do think that these images are closer, these references are closer to the left side of my body. It's kind of a slice thing. So I found these two from my primary care provider's site where they had uploaded the image. So basically, you can see that those don't look quite as healthy as they should. They're not quite in the spot where they should be. So that's what we're looking to repair. That's what we're looking to take care of. So as this process unfolds, tomorrow morning I'm going to go do the procedure, and then probably tomorrow is Monday, the 16th. Probably by Wednesday, the 18th or so, I'll probably be in shape to record another video and let you guys know what my experience was like. I hope that this helps, and I will have more information for you here shortly. Thanks.